Good morning.
My name's Sarah, for those of you that don't know. How many of you guys have pets at home? Yeah, I do too. They're like our babies, right? They're like our kids. So when you take them to the vet, it's pretty scary. And especially if they're going in for something like a surgery, that's terrifying. Even with my own animals. I work at a veterinary clinic with my own animals. It's terrifying. Even though I'm going to be right next to them, it's still terrifying. So I'm a vet tech, and I kind of just wanted to give you guys a little bit of insight on my job. One of the more important aspects of my job, which is surgery. So today we're just going to learn how to prepare an animal for surgery. Okay, so the first thing we need to do is gather our supplies. This is kind of make sure we have everything ready to go before we sedate the pet. That way we're all organized. So what we need to do first is get our IV catheter, make sure we select that size. There's just 3 different sizes we use, small, medium, large, based on the size of the animal. We're going to pick our endotracheal tube size. And the way that we do this is if you're looking at a dog and you see the front of his nose, that little space kind of right here, we want to match that to the size of the endotracheal tube. So we just kind of hold it up, make sure it's the right size, and that's usually a good estimate of how big their trachea is. So we're going to pick that. Next, we need to cut our tape to make sure we can place our IV catheter nice and secure so that doesn't come out. And we're going to assemble our anesthesia cart. So we have an anesthesia cart that is on wheels that we kind of pull wherever we need it. So when we're setting up the patient for surgery, we have our anesthesia and oxygen. It's nice and portable. So we're going to make sure we have that all ready and handy and connect our tubes to go into the endotracheal tube to keep them on oxygen while we're preparing them. So we're going to calculate our anesthetics. The main ones that we use are Dormitor and Torbitrol. And Dormitor is a anesthetic. It's fairly new, and the great thing about it is that it can be easily reversed. Dormitor makes another injectable called antecedent. And if you notice that the patient's getting a little too deep, needs to kind of come out quickly, we give them the injection antecedent and it reverses it immediately and they wake up. So it's really, really safe, and I got that information from vetmed.wsu.edu. And then next, so after we have everything kind of prepared, ready to go, we need to draw blood from the patient. It's very important to do blood work beforehand, because if they have an underlying liver or kidney issue when we sedate them, it can throw them into all sorts of problems. So we do a little bit of blood work, make sure everything's good before we put them under anesthesia. All right, so just preparing them. Once we've done the blood work looks great. We have all of our stuff set up nice and organized. We're going to sedate the patient, and we're going to sedate them with that Dormitor and Torbitrol mixture. And the Dormitor is the sedative, Torbitrol is a little pain medication, just in case it's going to take the edge off. If they're going under surgery, they're going to wake up a little painful. So give them that little sedative. This doesn't knock them out completely, just makes them a little woozy, a little bit easier to deal with. So then we're going to set the IV catheter. We're going to place our endotracheal tube, kind of connect it with this little tie behind the head, and then we're going to connect the patient to the oxygen and the isoflurane, which is our gas, inhaled gas. And isoflurane is a newer form, but it's incredibly safe, and the great thing is that it enters and exits the brain fairly quickly, so it reduces the risk of any complications. And I got that information from vet.Purdue. So after we do that, the patient is connected to anesthesia, it's connected to oxygen. At this point, they're fairly out. We can do whatever we want to them. We're going to make sure that we connect the heart and respiratory monitor. This is so important. We need to make sure that their heart rate is staying nice and steady and that they're breathing consistently. It has 2 little beeping sounds, so that way, even if you're not looking at the numbers, you can still hear it. So if you hear those, beeps starting to get a little bit low, you can kind of adjust accordingly. So after they're connected, we can hear the beeps, everything's going good. We just need to prepare the surgical site. So say it's a spay, cats, dogs, they're all pretty hairy. We need to kind of shape up that area and just do a light cleaning. Okay. So after that, we're going to move our patient into the surgery suite. So we have our little portable machine. At this point, we disconnect them from the portable machine, carry them into the surgery suite, put them on the table there, connect them into the main oxygen anesthesia machine that's already in surgery. I think here, this is the anesthesia and oxygen machine here. This is probably the portable one, but it just kind of gives you an idea, something like that. And then over here would be the heart and respiratory monitor that they're connected to, and the endotracheal tube here. So after they're on the table, we need to apply restraints. Sounds kind of barbaric, but if they start waking up during surgery, we don't need a cat or dog flying off the table. So we have just restraints that go on both arms and both legs. And then we're going to select the appropriate surgical pack. There's a couple different packs we use just for neuters or spay or laceration. We just need to make sure we have that appropriate pack with the right tools that the doctor's going to need. And then also prepare the veterinarian's gloves and mask for the surgery. Now, the veterinarian, their livelihood is on the line, so for the vet techs, we're setting them up, and if we do something wrong, they mostly get blamed for it, and they can actually go into, if something goes wrong with the surgery, there can be an investigation initiated, and they could lose their license. So I got that off of rcbs.org. So very important that we're doing a good job to make sure that their job is as easy as possible. And so in conclusion, we need to make sure we're organized, have all of our stuff together, all of our supplies. We need to prepare for the right procedure, make sure we're shaving the right area. If the dog's having surgery on the right leg, make sure we don't shave the left. And we need to make sure that we do a nice transfer into the surgery suite, make sure everything's very clean, make sure we have everything set up appropriately. So, those are my resources. Any questions?